Well, good. I think that we have everyone. Excellent. Well, my name is Joan Kennedy, and I head up the Consumer Health Engagement Strategy for CIGNA. And first and foremost, we want to thank you all for participating and joining us today. This is really exciting. It is CIGNA's first Health Innovation Challenge, and so we were excited to put it on. And Cameron over here, who's going to be talking to you, is sort of the brainchild of it, and it's been a lot of hard work, and we're very, very excited, and so excited that so many folks joined the challenge. So I want to thank you and welcome you to our event. So really what we wanted to do in terms of how sort of the hackathon and our Innovator Challenge ties to CIGNA is that we really want to be able to use the rich short resources that we have, our data, our services at CIGNA, and tie that to partners that can really take that information and create innovative tools in the marketplace so that we can really create that personalization and engagement and relationship with our customers going forward. And so we know that, you know, for folks who don't know CIGNA well, but for folks that do, I mean, health and improving health is really just the fabric of who we are. It's part of our culture, it's part of our mission statement, and it's really what we believe in as a company. And so what we're trying to do is take that, especially with all of the newness and things that are happening in healthcare reform, right? I mean, a lot of change is coming our way. It's going to bring a lot of great opportunities, and I think one of those is how we're going to really work with consumers to create that direct-to-consumer experience. And obviously technology and the things that you guys create on a daily basis is critical to creating that really good personalization experience, something that's interesting and something that ultimately brings value not only to that person, but helps improve our whole health system, right? You know, we've got a lot of challenges as a United States, and I think the work of all of us coming together to try to make a difference is really important. So again, want to thank you very, very much. I am also one of the judges, so I will be sitting next to JP here, and I'm going to let the judges introduce themselves, and then I'm going to turn it over to Cameron. So JP?
Yeah, my name is JP Lorty. I'm the chief architect from the technology side. Deal with all aspect of technology. I know you're listening there, but can you hear me? I can speak louder if you want. Anyway, so very supportive of this initiative. Put some of my own budget into this, and I decided to come to be a judge. So that's how
we love JP.
How important it is to us. So, and I have three of my key lead architects here today. So if ever you want to know where we're going from technology perspective, we probably can connect the dots at 80 or 90% accuracy at this point. We don't have the complete picture. I just want to make that clear. We're early in our offering of this customer API, and we're looking for partners to make this a success. So that's very, very important to us. Okay?
And Jackie?
Hi, I'm Jackie Ave. I lead the U.S. product organization for CIGNA, and my team is responsible for bringing solutions to the market, so delivering market solutions that improve the health and the healthcare spend of our customers. So we're very focused on bringing solutions to market that add value to our customers, to clients, and to CIGNA. And again, the areas that we're really interested and excited about are anything that help our customers engage with us to improve their health and the affordability of healthcare services. So I look forward to seeing what you guys have.
Matthew?
So I'm Matthew Holt. I am the co-chairman, and I sort of co-run the Health 2.0 conference and the Health 2.0 organization. And Health 2.0 is probably best known for its conference, but we also run a lot of developer challenges, long-term developer challenges similar to this one. We work with the ONC and many other organizations doing that. And I'm here primarily because when I saw CIGNA was doing a challenge, I emailed Joan to ask her what on earth was going on, and somewhere or other I found I was committing my entire Wednesday afternoon to sitting here judging, so be very careful when you have to send an email to that woman. It's very dangerous. Anything can happen. Yeah. But
Thank you.
So I'm looking forward. And I have actually probably, compared I think to everyone on the panel, sat on a lot more of these judging panels because we run a lot of these hackathons and challenges, and you know, I've been involved in them for a couple of years now. And I have been staggered to see over the progress in our events and other hackathons and hackathons how much better the end result of people working has got in just over a few months. And partly because that's people are, you know, more people coming into the health space from outside. Partly it's because people are getting better and more facile with the technology. Partly it's because you're getting more support from large organizations like opening up APIs, and you guys, Aetna, many others are doing, Athena Health, many others are doing that. But also I think partly it's because of the urgency, as Joan said, of what we have to do as a nations and industry is really critical. And actually, I should let you talk more about that because yeah, well, it's getting urgent now.
All right. I'm Chris Robbins, and I'm the president and CEO of Body Media, and we're a device partner with CIGNA. Body Media is been around for about 13 years, and we basically, yeah, sure. I always have to, yeah. Can just show my bicep. Basically, a truly, on-body multi-sensor device that helps people understand various aspects of their lifestyle as it relates to various health conditions. And we're excited about this because we've been in this space for a long time, 13 years, and the information that we gather off the body is quite tremendous. What you guys got exposed to in this is a little bit more scaled down, but the analytical capability when you combine lifestyle data with other things that Signet has, for instance, as part of their entire data set, is really compelling. And I think that's where this whole space is going is, not just treating each of these data sets as one-off, and really what can you understand when you look at the totality and the trends of this data. So I applaud Signet for what they're doing because I think it's really, kind of a thought leader type approach to what they're doing here. So I'm really pleased to be here and see what you guys have all come up with.
Great. Well, thank you. So before I introduce Cameron, I just wanted to, if we could just give a great round of applause to all those guys in the back there. We've got a whole group from Signet who did a lot of work to put together the Codathon, and so many hours, so thank you guys. You've done a wonderful job. And now, Master of Ceremony Cameron, who actually is the brainchild of our Health Innovation Challenge. He's going to walk you through our day.
Thanks, Sean. And thanks for our judges for participating today. Much appreciated. And thanks for all of you, because this is what it's all about. It's about Signet starting to share its data and building new relationships, different than most of the ones we've created in the past. Our agenda for today is roughly as follows. We're going to start going into what we call the expert sessions. I've got the 6 finalists here. I'm going to announce the 6 finalists. If you didn't join the 6 finalists, we still want to talk to you. We're going to have an opportunity. Actually, Paul is around here. We'd love to sit down. Paul, stand up. Just give a bow. Paul would love to have a debrief with everybody to talk. Yes, very hard to miss. So if you're not the 6 finalists, that doesn't mean that it ends here. We'd like to still create a relationship with you as you guys work to evolve and develop the solutions. We're certainly here to support you. We've had a number of great conversations with individuals around this. So thank you all. Make sure you don't leave before talking to Paul. So we're going to, 2:30, we're going to start the expert session. What's that? So you've got an opportunity for 2 hours for the 6 finalists to go through and get some feedback to help refine their presentations and their solutions. We've got a number of folks here with clinical operations background. We've got a number of technology folks. We've got folks in the product and business. Use that, kind of leading into the 4:30 session where we're going to present to the judges. Use that to kind of refine your final vision. 4:30, we're going to go in the presentation. So for all the 6 finalist teams, we'll be here in the room. You'll be given 15 minutes to present, 10 minutes to present your idea to our illustrious panel of judges, 5 minutes for a little bit of QA. We'll end at that'll give us up until about 6 o'clock. The judges are going to quickly deliberate offside, and we'll come back in and announce the awards. And Paul will bring out the big check, and probably not. So we'll be satisfied just to get your name. So, oops, we're jumping ahead. So let's talk a little bit about let's get right into it. What everybody's been waiting for is, am I a finalist? So our finalists are, for the challenge, Better Appointment. So one of the things that we really liked about Better Appointment was it was interesting. It was an interesting solution to help prepare a patient for a better conversation with their provider, and we think that that's actually pretty important. The relationship between doctor and patient obviously pretty critical. So where are the Better Appointment folks? Who we got? Oh, welcome. Capillary. So team name was Allergy. Where are you guys located? Oh, there you are at the back. So thanks for coming. So this was interesting, too, because it actually is a solution that allows you to kind of use the strength of your community. So peers and obviously advocates, something of which Signet has a large contingent of folks, to help support that engagement and journey for patients. So good job. Welcome. And the next, oh, and these are not in order of priority, Santec, so our friends at the back. So Santec, you might have seen them down the floor. They were right across from us. That didn't influence our decision at all, but glad to have you guys. So for those of you who don't know, they have an SMS-based solution that is really customized to drive engagement. We think, engagement, personalization is a major part of helping people make healthier choices. So thank you for joining. Oh, and the soft brew team. And the product name was the Signet PHR. This was interesting. We see a lot of people that are trying to exchange data either with the consumers, the customers, or with the providers. This is an interesting opportunity to kind of share the data between both. I thought I had some interesting opportunities for engagement, so thanks for joining. And the Ahead research team. Oops, my screen just blanked out. So the product was called MetaSure. So we've seen a lot of submissions, not just in this, but some internal challenges that we've had around medication compliance. This was actually kind of compelling. We've seen that driving shared engagement for medication compliance and bringing along others on the journey, very critical. So we're looking forward to seeing that in the finalist presentation. So thanks for joining. And the YesWiki team. So PCMS is the name of their product. Where is Gary? So metabolic syndrome, as most folks know, and there's a bit of a focus in this application on that. We know that that's actually a continuing growing problem in health, and the kind of trifecta between diet, managing cholesterol, exercise, as an ability to kind of drive effectiveness in that is super critical. So very compelling solution. So thank you. So those are our finalists. I think we should give them So like I said, that doesn't mean that we weren't. It was a very hard decision between a lot of these. We would still love to talk to the rest of you. And this isn't the end for us. I mean, this is just the start of a long set of open collaborations between folks. We need feedback from what you guys have seen about what we're doing. We need help and support from others to make it better and continue to evolve it. So feel free to grab any one of our folks. They're kind of hard to miss in those in the black shirts. I apologize. I never found time to get mine on. So thank you all for joining us today. Finalists, we're going to go into our expert session, so feel free to stay. Folks, stay as long as you want. Help yourself. We've got lots of food out there. And feel free to talk to one of our folks about grabbing a T-shirt or a grab bag. So, and thank you all for the folks that submitted. So, all right. And we're off. For any folks that are interested, feel free to come back at 4:30 for 6 o'clock. Sorry, for the announcements of the winners. We'll look forward to seeing you then.